Global Links forms long-term partnerships within a rubric of public health. So we use public health as our guide to identify gaps in systems where we can leverage our surplus rescue experience and logistics and distribution to support those who need the resources the most.
Global Links collects all kinds of medical surplus that exists here in Western Pennsylvania. Stuff that is not able to be used where it is and will often be discarded, and instead we get it back here where we have volunteers who help us sort it and pack it and make sure it's all good, and then we're able to redistribute it to partners in public health institutions, both in Latin America and the Caribbean, as well as right here in Western Pennsylvania.
I think what sets us apart is our experience in bulk purchasing and in rescuing surplus from all these universities and hospitals that we work with. Also our warehouse and our capability to store all these materials that sometimes our partners are not able to store in their organizations. So we are able to do it for them, and we are able to meet their needs.
We have maybe thousands of dorm mattresses here right now, along with beds that we get from all the different universities in and around here in Ohio. As they're rehabbing dorms, it turns out it's going to be less costly for them to just throw out everything in the building than it would be to pay to store it for the construction period of time. But dorm furniture is made for multiple users, much like what a healthcare center needs to be, right? And so we bring in beds and mattresses, and then we're able to redistribute them to our partners in Latin America. We have the two most recent ones. One went to a clinic in Honduras. They had been hit by a hurricane and lost everything in their building. So now they are full of dorm beds from Duquesne University, actually. And then even more of my favorite is Nicaragua has one of the second highest maternal mortality rate in the Western Hemisphere, actually, next to Haiti. And the Ministry of Health really wanted to do something about that. And so what they came up with was this system of maternal homes, where they built these little homes around the country that women in rural areas have easier access to. It's dormitory style housing. Women can come and stay there while they're pregnant. They get seen by a nurse, midwife, doctor during their pregnancy. They have an attended birth, and then they can stay for a little while after they give birth to make sure they get back up on their feet. And this is really helping to reduce very preventable maternal death. And so about half of those maternal homes in Nicaragua right now have been furnished with Pittsburgh University dorm furnishings.
Global Links is unable to individually donate these devices to people in the community, but CLASS can. So the partnership is really about taking the donated items from Global Links to CLASS to then distribute it to many surrounding counties in and around Allegheny.
So over my 20+ years at Global Links, we, for many years, were focused internationally. And when I had my first child, he had a respiratory sort of attack in the middle of the night. He was less than a year old, so what did I do? I took him to the local children's hospital, and they sent us home with a small breathing machine called a nebulizer. At the same time, our program team, so those who travel internationally to some of the most resource-poor communities, were bringing back photos of moms like me with their children in arms, waiting in line to use that very same machine. The same machine that I got to use in my home for my single child, they were waiting in line to use, and each treatment takes 20 to 30 minutes. And that was sort of the aha moment, and we started our Breathe Hope program, which connects home medical equipment. So something that I used only temporarily until my son was old enough to use an inhaler. We didn't need our nebulizer anymore. But the reality around the world is many people don't have access to that to use in their home, but here in the United States, they may have children that sleep in different homes. We needed that machine anytime he had a breathing problem, anytime. So that program is now expanded around the country, so we can provide those small breathing machines refurbished to free and charitable clinics, so moms like me don't need to worry about where's the one machine if they're at grandma's house or auntie's house or dad's house. They can have one in every single pillow that baby sleeps on.
Something I love about the Global Links partnership is they're very mindful about what they donate to us. They make sure to inspect all of their items for safety and that it's clean and it's ready to go for somebody to use. A lot of our wheelchairs come in packages like this, where the legs are already boxed up and it's completely ready for anybody to pick up, and it's been checked.
Our volunteers have a huge impact. There's so much real work that needs to be done. 15,000 volunteer hours a year is not even touching the work that needs to be done, right? And so to be able to utilize the people who really want to help, give them a meaningful job that will really help improve health in communities with need, it's just great. I feel like we are so lucky to have the space and the size to be able to put so many volunteers to work.
Although I couldn't be there today, I want to thank all of our staff, but also all of our volunteers, the thousands of people from Western Pennsylvania who help us count and sort and pack and quality check and clean, and all of the folks who donate 2 to 200 hours a year, as well as all of our partner agencies for making Global Links the special place that it is, connecting our region's surplus to saving and improving lives here and around the world.
I would like to thank all of our partners that provide services to our communities and that help all of their clients and communities in need. We can't do the work we do without you because we rescue all the surplus, but you help us meet the gaps. So thank you so much for your partners.
Congratulations, Global Links. We're so excited about the partnership we have with you, and we can't wait to see all that you do in the future.